Reason one is I think we have Colin and Levine joining the EFAX group. Currently, right now, we have Rose and Sims attached to the electronic EFAX. So what's going to happen? We're going to have more EFAXs coming in from all sites that would include Rose, Sims, Colin, and Levine. So the reason why is we want to go ahead and prepare these staff so they can also help out with the EFAX. Currently, the EMR trainers are the ones that are going through the EFAX and sorting all these files and making sure that radiology reports, any pharmacy request refills are being sorted to the appropriate means. But since we are going to start seeing a little bit more volume, we want to make sure we train staff just so that they can also assist with this current workflow.
Thank you.
All right, so I'm going to go ahead and begin. So what's EFAX? Like I mentioned, it stands for electronic fax. All incoming faxes to the clinic, and that means that the clinic will be coming in through this electronically, and that is through each clinic respectively, like Sims, Rose, Colin, and Levine. Document. So where can you do EFAX, or where can you find EFAX? So it's going to go under the application launcher. You're going to go ahead and select document management. It is really highly recommended that you also log into Enterprise EHR. The reason why is because you just want to make sure that you know, you go to the patient's chart so that you know which provider you're going to go ahead and file this to. Once you file these faxes, you're pretty much sending it to the provider fax. So for example, once we get like a radiology report, we want to make sure we are sending this to the correct provider. It could be either by the rendering, or it could be by the ordering provider. How to access EFAX? So once you open document management, you want to go ahead and open up batches, and it's up here circled. And with the new upgrade, you can now set up your settings so that once you open up document management, this particular window, the image batches, opens up automatically for you. So from there, normally us EMR trainers, we then start from the oldest batch or the oldest auto import. And from there, we move on up. And then just so that you know, it's very important that you unselect show batches to me. So that's going to go ahead and let you see all batches that are currently coming in through EFAX. And you want to make sure you add AAA under the find batch field. AAA will allow you to remain in place. So say for instance, if you are currently working on batch 109 and you want to stay in that particular space or in that particular field, if you don't have AAA on that field under find batches, it's going to take you all the way either to the bottom or it's going to take you in a different location. So it's going to move you out of place. So it's very important that you always type in AAA so that it keeps you in that particular place where you are working. How to unlock EFAXs? So once you open up this batch, it automatically gets locked to you. This will allow people to know that, hey, this person or this next-gen user is currently working on this batch. So for you to unlock it, just go ahead and exit the file or the batch, and then just right-click on the batch and select unlock. You can also check the box. There's a little box next to it. You could also check that box off and then just go ahead and select unlock on the top here on this option as well. And you can also unlock as well as there. Junk EFAX. So aside from receiving reports, radiology, imaging, any outside medical notes, ER medical notes, we receive a lot of junk faxes. And these may include, for instance, healthcare LA IPA authorizations, LA Care. Sometimes we get these like money scheme ones where like, hey, you just inherited $20 million, you know, you need to call a lawyer in Canada reclaim your prize, or any of the, any other propaganda. So those we remove automatically. Those get removed. Those get deleted because we don't need them. And then there's other ones where, for example, surveys, any LA care surveys that are particular to the clinic, that are useful for the clinic, or that they have to use, go ahead and do this, or if there's any other faxes that say, hey, any credential recertification, etc. Those get saved as a PDF file, either in the X or N drive. It all depends. Some users might have the Encounters X, or some users might have the Encounters N drive. But it's the same process. I added that just because some users, or some next-gen, or not, I guess, depending on how what particular group you're working with. Some front desk, I understand, has the X Encounters drive, and then some of the EMR trainers here have the N drive. So it's the same. I just wanted to add that there is an X or an N at the end of the Encounters. So it's the same. I just wanted you guys just make sure that it's the same purpose. So you want to make sure you select rows, you select fax, and you select care coordinator, so that these documents get sorted. Non-patient records. So aside from getting records that are for our patients, we also get a lot of records from inactive patients, or patients that are either new or there are incoming new patients. So what we do with these files is we go ahead and save them under the non-patient or active non-active file. And what constitutes a non-active patient is any patient who hasn't been with here at the clinic in the past 3 years. And we go ahead and save this, and we go ahead and save it with last name, first name, any initial, middle name, date of birth. And then we go ahead and sort this out in a non-patient or non-active file. Again, to access the folder, like here, this particular example, it will say Encounters as, and at the end, either it will say, we'll have an X for local drive, or N for network drive. That's pretty much the difference. And then how to save a PDF file. So when you're in the file, you're gonna open up and you're gonna select the print icon up here, and just go ahead and select. And then just make sure once you select, you make sure you wanna change the printer, and you change it to Adobe PDF, and then you select OK. And then you select the appropriate folder you wanna go ahead and save this document. In this particular folder, we are saving it to the rows, or actually the SIM, fax SIMs, and we are saving this document there. Medical notes greater than 50 pages. So provider Thinouts, like you saw in the previous page, anything greater than 50 pages does not get scanned in. We go ahead and save those, and then we do there's another process we do with those, and they'll come up right now in the next slide. So we go ahead and save those. Sometimes, sorry about that. So sometimes what it is that we save them so that the providers can go ahead and review them. It's called a Thinout. Sometimes there's a lot of pages that don't need to be scanned, so the providers go through them and they just go ahead and select the appropriate pages that need to be scanned into the patient's file. Again, these get saved on the PDF. You will either save in rows or same fax. And for children's or colon and the new providers, once it goes active, once the eFax goes active for this particular site, we're going to go ahead and save to the rows eFax folder until further notice. Until we get an OK, they're going to probably get a separate folder just like SIMs or rows. So here is a list of provider Thinouts. So some providers have elected to either receive these large batches or large files either by email, or some have selected to go ahead and print them out. I'm not sure if you guys received the attachments I attached to this Zoom presentation, but I do have more instructions on that, and I can go ahead and send those out too as well in PDF format. So we try to update our list as much as we can. New providers come in, we go ahead and ask them, and we update the list. So we have the most recent updated list as well. So how to upload a document into a patient's chart. So this is for something that, say for instance, it's a PDF file, you have it saved, but you want to upload this into the patient chart. So this is not from eFax, so this is a little different. So what we do is you want to make sure you have the document saved as a PDF format, and then you select this little thing. I like to call it the little vacuum because it looks like a little vacuum attachment. So you want to go ahead and select that, and you want to make sure you have file import here on the acquire profile, and then from there you go ahead and select acquire. Here it's going to go ahead and populate where it's going to ask you, okay, select the document you want to go ahead and choose from. Sometimes you have it saved either in the PC, in your drive, etc. documents. Once you select the file, just hit open, and then this page will appear on the document management page. So that will be similar to how we will file a eFax into the patient chart. You type in medical record number, you type in the date of service, etc. And then this will then go ahead and be uploaded to the patient's chart under a category that you select, whether it be a radiology, whether it be labs, whether it be patient consent, any of that stuff. How to page. So with these faxes, what we find is that we get a lot of junk pages. So a good example are cover pages. So what we do with the cover pages, we go ahead and hide these pages because, you know, there's really no need to have them in when we're scanning it into the patient's chart. So what we do is once we open up the batch, we see this little guy right here, little Halloween looking face. We just go ahead and click on the page we want to hide, and it will remove the page from the batch. Say for instance, somehow, hey, you know, there's a couple pages, or there's a couple, sometimes it happens, there could be more than 4 cover pages in one batch, and then you accidentally click an extra hide the page, but you want to recover that last page. So what you do is you right click into the file or the page, and then you select show hide pages. This will allow you to unhide the page. I want to note that once you do that, it might not be located in the same spot. So say for instance, you hit page 5, but that's not what you wanted to hide. You want to bring it back, you bring it back, it will be added to the last page. And then from there, you can sort it. Okay, filing documents. So this is what I was getting to. So we learned how to import a PDF file that has been saved to one of our folders. But now, how do we file a document or a batch that's coming in via eFax? So once you open up the batch, this window will appear. You will see the document. In this case, this is a referral from, I think it's right elbow pain, so it looks like it's probably ortho. So then you want to go ahead and you want to open up EHR. So you want to make sure, okay, where is this file going to go to, or pretty much where am I going to send this file to? Example, it could be if it's a UCLA-IM or if it's a resident clinic at Rose. There are certain providers who are assigned to receiving these in their pack. So for example, SIM has a schedule. Mondays is Dr. Solomon, Tuesdays is Dr. Ruhan, Wednesdays is Sinkford, Thursdays Solomon, Fridays Hoffman, and any other notes like OB-GYN, so Dr. Lamb, stroke, etc. And then Peds, non-urgent, Dr. Corral, or if urgent is Dr. Hoffman. And then at Rose, for like the Santa Monica family clinics, it's Chung, Dr. Loaiza, Andres, and then for Peds is Dr. Michelle Aguilar. So again, you want to make sure you match the correct provider so that the provider gets the correct provider gets this so that it gets reviewed on time. You then enter MR number, you hit tab. So once you enter MR number, you hit tab, and date of birth, first name, last name, etc. will go ahead and populate for you, so you don't have to type that in. And then the only thing you type in is date of service, and then you have to select the rendering provider or the provider who's going to receive this in this pack. And then you want to label this. So for instance, if this is an ortho, note, you want to go ahead under notes, you want to go ahead and type in ortho note. So it lets the provider know what this document is, so where is it coming from. So continue. So this is what I was talking. So you want to make sure you label it. So for notes, you will describe the type of document. For example, if it's a derm, GI, cardio, etc. If it's an imaging, you want to make sure you type in if it's an ultrasound of the abdomen, if it's a mammogram, if it's an MRI, etc. And then, so you want to make sure you task. So we're doing tasking as well. So sometimes we receive either ED reports or hospital reports. Those get sent to call center, and all the other referrals or the notes, sometimes when they get referred out, they get sent to the coordinator. Referrals, the reason why is these is for closing the loop. So for referrals, we're closing the loop on these, so the coordinators will get this, and then they let the coordinators know, okay, we already received this file. We go ahead and close out the referral, saying that we closed the loop. The patient went to the dermatologist. We're going to go ahead and close the loop on this order. And then once you go ahead and you're done, you want to go ahead and file each page. I do recommend going one by one. The reason why is because sometimes you'll get multiple pages in one. So say for instance, it will be a 10 file batch, but here and there they'll sneak in like a different patient. So it's highly recommended that you go one by one so that you know that you're filing into the correct patient. Because sometimes you'll find that, hey, this particular batch has 2 patients. The last note will have like a different name. So you want to make sure you're filing the correct document into the correct patient's chart. So we highly recommend that you go one by one. And then once you're done, it will let you know, okay, you're filing in the last page. You say yes, and then you check EHR to make sure that that document was successfully transferred over to the patient's chart. So this is what I was referring to, but we are now, as EMR trainers, we are doing this for radiology imaging. So what it is once we file, we are closing the loop. Currently right now, we're doing these for the radiology reports. So once we get the reports, we go ahead and enter the information, SO, and then date of service, we select the rendering provider, we type in the type of imaging it is, and then here we'll get the order. So for example, this looks like it was like an x-ray of some sort or an ultrasound. You check the order off and then you select complete. This will close the loop for the imaging. And we at the same time file it. So we'll be closing the loop on the radiology reports and at the same time filing them into the patient report. So once you check into the patient's chart, not only would the file will be imported into the patient chart, but we're also closing the loop on this as well, letting them know that, hey, we received this document as well.
Can you go through that just one a little bit more slowly?
Yes, definitely.
Thank you.
Yeah. So again, just select the type of document it is. So it's a radiology document. You type in the medical record number because you have your EHR open. You select tab. The name will then populate for you. You type in the date of service. You select the provider you're going to go ahead and file this to. You type in the note, and then you check off on the order that you receive. So for instance, if this is the ultrasound out of the chest, you want to make sure you check that box off, then select complete, and then file. And then again, you will then have this document in the patient chart at the same time closing the loop on the radiology report.
Thank you.
Filing any labs or any outside labs, pathology, biopsies, similar. You want to select document type under labs. You go ahead and type in the MR number. You select tab. Then you fill in the date of service, and then you select the rendering provider, and then you type in the notes. You can say, hey, biopsy, pathology report, or any lab. It could be from OB-GYN labs or a derm lab, etc. And then you put that in a note and then file it. And then you want to make sure you hit file. Any medical requests. So it's similar to how we get the other important faxes, and then we sort them into a specific folder. So for rows, we want to make sure we save those into the rows folder, the fax folder, and we label them as medical record requests, and we then print them. So we print them and then we drop them off. So for instance, if we're at rows, we'll make sure we print them and then we drop them off in medical records so that then the medical records team can process these. Same as SIMS, currently there's like a little folder as well. They have two folders, one for medical records and one for provider signatures. And it's the same at rows as well. And then medical records team will go ahead and file this out as well. And then there is a note here. So faxes received for other people, for example, all that's like if it's addressed to a specific person, we save them and then we go ahead and we could email them or forward them to that particular patient, or I'm sorry, a person. So this was what I was mentioning in the other slide, similar to the medical records request. We do get provider signature requests. We do the same. We save them as PDFs. We then sort them out in the correct folder, and then we print them out and we drop them off in the provider signature boxes at medical records. For colon children's Levine, currently we're putting everything at rows. I understand that they're going to jump on in the eFax. Maybe they might get a folder, might not, but currently we're going ahead and saving these in the rows eFax folder for now. Preops, similar. We do receive preops via eFax. There is a preop folder. We go ahead and select the preop folder and we save these preops under the preop folder. And again, we use a similar format as a non-patient or non-active patient. We use last name, first name, date of birth, MR number. We do add the site that this particular patient is going to, so that it's there. So if they're getting a pre-op at SIMS, we go ahead and add SIMS. If they're getting a pre-op at Rose, we add Rose to that particular name. And then sometimes we do get interrupter e-faxes. So sometimes we do get faxes that are not completed. So what we do is we reach out to them. For example, if it's Western Imaging, we reach out to them and we call them so that they could resend it over. Sometimes they have the incorrect name or the incorrect date of birth. And we just want to make sure that it matches with our records so that when we're filing these in, there's no like discrepancies in between the medical records from the office that we're getting this in our medical records. So we go ahead and, for instance, Western Imaging, we call them and we ask them to go ahead and file this as well. For any pharmacy refills, we save them. So now there's a folder, pharmacy refills. We go ahead and use the same format. We type in the patient's name and date of birth. So other faxes, so like missing person flyers, we print them out and we give them to security. DMEs, we use the same format. We save them in the care coordinators folder. Refer related requests, go to the coordinator folder. Provider update flyer, we delete those. Physical therapy notes, depending, some of them have like, they require a provider signature. So we follow the same format or workflow whenever it's a provider signature. We save them and then we hand them out to medical records so that they can go ahead and hand them out to the providers. Equipment orders, we save those as well. Facts about appointments with the clinics, we delete. Child protective services and all that other stuff, we treat similar to how we treat signatures, or if they need to be expedited, then we go ahead and make sure that they get to the correct person so that they get expedited. Anything in regards to that stuff. Okay, any questions? Always feel free to reach out to the EMR trainers. We are located at Rose, SIMS, via email, and Levine. I did wanted to show you just the eFax. Let me see if I can exit here. So wanted to show you one. Just
I think it's because we're all watching you. That's why your password doesn't work.
yes, yes, it always happens. It always happens. So like I mentioned, you want to make sure you have the EHR and document management open. So I already had one, just for this particular purpose. So it's this one. So I double click on it. The batch show open. Takes some time sometimes.
And just as a reminder, you said to make sure to unclick the show batches secure to me so you can see all of them, right?
Yes, correct. The reason why I have this now is because I went ahead with the new update. I went ahead and I configured my settings. So now I have it whenever I open up, and I had it open already for a while. But whenever I open up, it will show up there. But you want to make sure you uncheck the box and you add AAA in the field batches so that you do not, I guess, it will take you out of place. So once you start filing, it will take, if you don't have AAA, it's going to take you to like a different spot in the list. So if you add AAA, it's going to keep you in that particular spot you were working on. So for instance, this is a ultrasound report. I know you guys don't see nothing. You might think that this is an interrupted an eFax or a report, but no, it's an actual report. It's telling us, hey, please look at the mammogram to look at the ultrasound findings. So what I do is then I go ahead and just double check. And I just want to make sure that I find the correct patient. Okay. And then I do see that it was ordered here by Dr. Lamp. So here it is. And then I go here just to make sure that there's no duplicate, and it looks like they already filed in the mammogram. So what we're going to do now is we're going to go ahead and file this in. So we go here, select Radiology, and I just type in. You can also use this here, and it allows you to look it up. Go ahead and use this just because it's sometimes when I have duplicate of the same patient coming in, that's when that one comes in handy, because you can just use the last patient that you had, and then it allows you, it's easier, and it gives you the information right away. And then, so what I do is I want to make sure I look at the date of service. So it's 121. And then again, I'm not going to send it to Juan because Juan is an LVN. So I'm going to go ahead and send it to Dr. Lamp. And I'm going to go ahead and label it US report. And I'm not going to go ahead and close the loop on this one because this particular order is a little bit different. This one is a needle biopsy aspiration. So this one's different. So the loop was closed when they went ahead and filed the mammogram, since it included the ultrasound. And I'm just going to go ahead and select file. So it's letting me know there are no more documents in the batch. And then I say yes. And then I just go here, click refresh. I just want to make sure that the document is there, and there it is. Okay. Any questions? Let me look at the, okay, so I'm going to go ahead and stop sharing screen. Okay, so yes, like Donna says, it's best if you have a dual monitor. So you want to make sure it's much easier. Here, the reason why I was able to show you EHR and e-faxes because my screen is a little bigger. I'm LED, so the screen is a little bit bigger. But it's really, it's best when you do have two monitors because you could have EHR and then the e-fax on one, and then you could definitely you could see through both.
No, when UCLA COVID-19 lab reports come in, is there any distinguishing feature in the queue that that batch is COVID-19 results?
Yeah, the covering fax. So the fax covering the fax sheet or the cover sheet is different. It's different from an ED report. It's different from a hospital report. So right away, I could tell that this is a COVID result batch or a file that's coming up just for COVID.
Can you clarify the question, Matthew? Do you mean like when he's looking at the batch, the information that's coming in, does he know it's COVID when it's just coming in without opening the document?
It sounds like you have to open the document first and see what the cover sheet is.
Yes, that's
correct. Yeah,
okay.
Because you can't tell where it's coming from. And I tried to see if I click on batch properties just to see, but no, it doesn't. So I mean, I speak for myself. What I've known is I just familiarize myself with the cover sheet, and then once I see it, I know it's a COVID result, and then I know from there, following the current workflow for the result location, then I go ahead and file that into the patient's chart.
Okay, thanks.
Yeah. So here it is. Let me show it to you. Let me share my screen one more time. So here it is. So this is a COVID result. And then there it is.
Yeah, that's one of the downsides, Matthew. We can't, there isn't anything that comes through in the batch that allows us to distinguish whether they're reports or anything. It's just a fax number and the date and time, I think, is what comes through.
So I guess the same originating phone number does give us an indication of where it comes from, even if we don't know what it is.
Can you go back to the batch again, Abnel, so we can see?
Sure. So yeah, it just tells you the batch number, and the description is just auto and then a bunch of numbers.
Yeah, so I'm sorry, there is no phone number. It's just the batch number. So there's no way to tell what number it's coming through.
No. Yeah. Any other questions you guys may have?
Yvette had a few questions that she chatted in. One was, some healthcare layoffs have specific requests for us. Do you review them all? And I believe that Cynthia and Donna responded, and if the authorizations have notes, we file them to the care coordinators folder.
Yes.
And then there was a little bit of I think you mentioned that you close the loop. It's only for radiology. But
yeah, currently right now.
Yeah.
And then for referrals, we test the coordinators, and then they go ahead and take care of that.
And Yvette, what that's referring to when he says we test the coordinators, it's that report that we found where it's document tasking on the report server. So I don't think an actual task comes through to the coordinator, which we have to run the report.
A report gets run. Yeah, correct. Yeah. It's highly recommended that you name the file. If it's a medical note or if it's a radiology report, you want to name it. For labs, even if you name it, it doesn't pop up under categories. It will just say the date of service. But if you file a referral or if you file a radiology report, it will go ahead and file it with the name you give it and the date of service that was filed with. Yeah.
Susie, it's Gladys. I have a question.
Mm-hmm.
batches, is it multiple medical notes that we're going to be filing each individually, or is it
So,
each?
so no, sometimes you get those records. So for instance, a good example will be a county. So county sometimes sends 3 or 4 patients in one fax, and then from there you have to sort it. But sometimes these batches are greater than 50 pages. So most of the time we see those in that sense. So you'll see a batch that has like 50 pages or more, and then in that particular batch, there's maybe 3 patients that are being faxed over in that batch. So what we do is we just make sure that we save those as PDFs, and then we send it to the provider so the provider can then sort it out.
Can you go back to your screen up now and show us, you know, where you have the batches and the AAA, so that we can help define what batch actually means?
Yeah. So that batch will be something that has either the batch number would be 120,
sorry, I
1905,
can't see your
and then
screen.
oh, I'm sorry.
That's okay. I do it all the time.
Yeah. So here it is. So the batch number, it's so what can be considered a batch is so as you can see here, it says a batch number, and then it gives you a batch number, and then it gives you auto port, and then auto 0121, and then it gives you the number. So this number represents the eFax number that we've gotten today. So today we received 266 eFaxes, and then the name is batch number 120-905. But the EMR trainers, to make it easier for us, we always refer like, hey, I'm working on batch 156, just because it's easier to refer to that because, you know, instead of using 120-1612. So
I see there's a description, but then there's a column called docs. Does that indicate how many pages are in that particular batch?
No. So see how there's a 1. So
It doesn't mean anything.
and I think the one, yeah, the one I opened, I think one of them was a COVID results, and it had 3 pages in it. So it doesn't, yeah, it just letting you know it's, hey, it's maybe it's like a document. I don't know what they're implying in that. Yeah.
Right. So you really don't know what you have until you open it.
Correct. And then sometimes there's information in the cover sheets. Sometimes, you know, myself and the rest of the EMR trainers, we go through that, and we know, like sometimes we'll say, oh, please fax back with provider signature. So right away we know that this is a provider signature, and then we just look at the second page just to make sure that we know in what folder we're going to add this, so whether it be rows or SIMs.
Thank you.
And yeah, and then to answer Gladys Page's question, yes, sometimes we do get these batches that come in with multiple patients, and you just have to make sure that you don't file, you know, one of those pages into the incorrect patient.
And then Yvette has a question. She needs some clarification around whether we rename a file when a fax is received. I don't know if you want to take yourself off of mute and ask the question. She may not. She may be in a place where she doesn't have access to the microphone, so that's a little bit challenging.
Okay, can you hear me now?
Yes, thank
Yes.
you.
Okay, sorry about that.
No
So
problem.
before, when Adriana would send us anything or drop anything in our folders, she would rename it. So when a fax is received, there's no renaming the file when it goes into a folder, or does it remain with that eFax number that it comes with?
The question is when you,
it,
yeah, go ahead.
It gets named when we file it into the chart, but when it comes in as a fax into eFax, it comes in with the current description I just showed you. Let me share my screen again.
I think what she means is when you're putting in, like the ones where the provider's going to sign the paper and you're putting it in that folder, are you renaming it there?
Yeah, we're renaming it. So let me see if I can show you.
Did I get that question right,
Yeah.
Yvette?
Yes, you did.
Okay, good.
Sorry, I have another question.
Uh-huh.
How about if I request an eligibility fax back? Will I be able to have it sent somewhere else where I can get that information quickly, or it will
Yeah.
go all to the batch?
No. So it's a batch is just, that's what it's called in document management. But if you say, for instance, you want something to come physically, you have a fax number, like say for instance behind front desk there's a fax machine, and you want to get it there, just give out that number, and then you go ahead and you receive your fax physically in that fax machine. But if you give the eFax number, then it's going to come in through eFax.
Okay,
I think we're trying to move away from having multiple fax numbers though, but that is a challenge that we currently are trying to figure out how to address better. But you're right, if you request it, it may take some time, depending on how many people we have working on the faxes and how many faxes are coming in. It may take some time to get that uploaded.
So this is a good example to answer Yvette's question. So she asked are we renaming these documents when we get them in? So yes. So I'm going to go ahead and do another demonstration. I'm just going to wait till it opens up. So this is a referral. And it looks like it's from hematology and oncology. So and what I'm doing is just I'm making sure, so I just want to make sure I look at the PCP and all that stuff as well. So I'll go ahead and do medical note. And I'm going to go ahead and name this and so what I do is just file, 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 and then yes. And then when I go here, medical note, it's there. So the name I gave it in the notes section under the notes field, it will reflect here on the categories.
Yeah, and the other piece to that question, which I think is what Yvette was asking, is if you have something like the patient's, something needs to be signed by the doctor, when you're putting it into the folder for each location, for like say if it's for Rose, then you rename that in that folder as well, right?
Yes. So say for instance, there's a what can I say? Like a, I don't know.
It's a survey from Healthcare LA for Susie. Then
Yeah,
you rename it.
there you go. Yeah,
Please
and then
print
we
out for
please print.
Susie.
Yes, correct. Yes. Thank you. Thank you for helping me out with that one.
Yes. Donna
Yeah.
says go ahead and show her the folder. That might be helpful.
Okay. All right. So here it is. So here are the folders, and then you can sort them out. But normally what it is if say for instance, like I already saved them or I pinned them, so they're more accessible to me. But you want to go here, and then hit encounters, and then I'm sorry. I don't know. So there it is. So and then you want to go. So there's the pre-op folders here. Rose is here, and then Sim is here. So then say for instance Rose, and then you want to make sure you hit fax, And then here are the other subfolders within the fax folder of rows. And SIMS is the same. So we have coordinators, DME prior auths, we have the pharmacy refills, and then this is where we do with the medical records request and the provider signature. So this one here, Susie had one, so print and send to Susie. So we'll go down the line, and then we'll make sure we look at them. If it's a provider Thinnout, we look at the list, and then we make sure to know if we're going to print this or we're going to email this to the provider, or if there's anything other than that, like a specific document, then we go ahead and email it to that person directly.
If a fax comes in incomplete, who follows up with the sender?
So,
that means yeah, there's not enough pages, or like it got blurred.
So yeah, sometimes. So if, say for instance, if EMR trainers have the time, or if we're able to, like say for instance, a radiology report, we go ahead and contact them directly and we ask for that report, and then once we get it, we file it in. But say for instance, if it's if we're working at a particular clinic where there's a lot of volume, for example, SIMS, where there's residents, and we do not have the time to go ahead and follow up with that, then we go ahead and we save it, we label it, and then we ask the coordinators to go ahead and follow up whenever they can.
Thank you. Any other questions? We have about 9 minutes. I think we're okay. Thank you so much, Abnel.
Thank you guys. Good questions. Thank you. Thank you so much.
All right. I think we can end the call now. Thank you, everyone.
All right.